So this is our final dashboard, and I'll be using these three graphs to explain my two research questions, which are what period saw the most community spread during the pandemic, and the second question is did the resulting community spread contribute to herd immunity and lead to a reduction of deaths, new cases, and total cases? So first, we need to answer the question, what period saw the most community spread during the pandemic? By looking at the graph below, it can be said that the peak in India was in September, and we can say this because of the lockdown measures that were implemented earlier on in the year when COVID was first detected. In the US and Brazil, it was in July, around this part, where we can see the US hit somewhere around 78,000 cases, and Brazil hits close to 70,000 cases. Um, in France, it peaks in May, somewhere around here, peaks somewhere here in May, and then continues to go down because of the harsh lockdown measures and stay-at-home orders in Europe. And the same can be said in Russia, where we can see that right there, Russia peaks somewhere here at 11,000 cases, then continues to decline. Among these nations, France and India had lockdown measures, as previously stated, and one of the reasons why India is very much, even though the lockdown measures ended somewhere in July, the cases were still somewhat low because of the statewide lockdowns which were present in a lot of places, unlike some other nations which had no lockdown at all. Now, we can answer the second question. Did the resulting community spread contribute to herd immunity and lead to a reduction of deaths, new cases, and total cases? In four of the five countries, the resulting community spread did contribute to a reduction in deaths. And this can be said because if you look at it, the deaths are very high here, whereas the caseload is still relatively low around the same point. But as you can see, when the caseload does hit somewhere around 78,000, the US has mod like deaths somewhere here. Now, this basically tells us that the new deaths, that deaths in the country are lower because of because more people are being infected and hence a lower amount of deaths as reinfections were milder, and this basically also created a bubble in the sense that people who are immune to the virus now didn't really pass it on as much, and so herd immunity did start to kick in to some extent. And one of the other reasons why the deaths were very high in the beginning is because no one was exposed to the virus. Henceforth, what happened is people were dying because their immune systems had no previous exposure to the virus. Now, looking at the trends of the graph, looking at the trends of the graphs, we can say that the general trend of the new death graph is declining, indicating that deaths are going down. And connecting it to the active cases here, it proves that herd immunity and previous exposure to the virus does in fact slow down the spread of the virus. Furthermore, early on the number of deaths are quite high, even though cases aren't. In the US, for example, where new cases stand at 21,000, deaths are nearly 3,000, which here, you can look at it right here, or somewhere around the same point, the difference is quite high. You'd expect deaths to be a lot lower when the cases are lower, but it's a lot higher when the cases are lower. Furthermore, when we look at new cases, new deaths, and active cases graph, it can be said that the peak of active cases, it seems like at the peak of active cases, it seems like new deaths cases both decrease and hit a low, indicating that herd immunity that forms as a result of a large number of people having the virus creates a bubble to prevent more people from catching it as well as making reinfections less serious due to the presence of existing antibodies. This somewhat proves that herd immunity does work until a new variant of the virus springs up that evades existing immunity.
Hello, Dr. Murphy. This is my video explaining my part of the project. My two research questions are: did the lockdown in India have a positive effect on the new cases? By which I mean that did the lockdown in India help fight COVID-19 in a sense? And my second question is that was herd immunity a viable option for dealing with COVID-19? I'll be using these five uh, graphs here to answer my research questions. To begin with, I will look at these upper three graphs. The scatter graph here shows that the daily cases during the nationwide lockdown were increasing at an increasing rate. Furthermore, it also shows that the points the cases, the data here has a good correlation, as well as that there are no outliers, which I believe is important as it shows that the data is reliable. Hmm. While the increasing rate does suggest that the lockdown did not have a good effect on the new cases for COVID-19, if we look at this line graph here, which shows the daily cases from April to September, April to May, which was the lockdown period, and June to September, which was known as the unlocked period. In other words, the lockdown was lifted after May. We can see that there's a significant rise in the cases here. Sorry, not the cases. The rate at which the cases are increasing is significantly greater here. In other words, I mean that the gradient of this line over here is much greater than this line over here. So this suggests that while the lockdown wasn't able to stop the spread of COVID-19 completely, it was able to limit the spread. Further evidence of this is seen from the bar graph here, showing the percentage positive plotted against the days. By percentage positive refers to the population that was tested positive. Shows that while the graph shows that while the percentage positive increased, that to an increasing rate, but if you look at it at a quantitative manner, we see that the magnitude of the bars is also rather small, with the highest bar being 0.01378%, which is a very small amount. This in turn shows that while the lockdown did not stop the spread, stop the increase in cases, it did limit them. Therefore, I conclude that it did have a positive effect on the cases. To answer my second research question, I'll be using the lower two graphs here. Looking at this line plot here, which shows the daily deaths, for India and the US from June 1st onwards, it is clear that both the countries experienced spikes in the daily deaths. The US, which is represented by blue here, sees an overall decrease in the magnitude of the spikes. The spikes going as high as 2,499 in June, while in September they were much lower, such as 1,206, 1,206 and 1,197. This decrease is evidence that herd immunity was a positive force in limiting the spread of COVID-19, which shows that it is a viable method for fighting against it. This is supported by India's number of in the line graph here showing India's deaths per day, which although has an increasing trend, but as time progresses, the rate of increase decreases, which you can see right here. The gradient of this curve of um the rate of increase in this period here is slightly greater than the rate of increase in this period here. This period here. This is further proof of herd immunity's effectiveness. Furthermore, looking at the line graph here showing the critical and serious cases, we can see that there is a significant decrease in the rate of increase, which is seen right over here. So, right here, 31st May is when the law, uh, right here, is the gradient here is much smaller than over here, which in turn suggests that more people are getting immune to COVID-19. This The fact that more people are getting immune to COVID-19 is evidence that herd immunity is indeed working, and therefore, sorry, was working. Therefore, it was a viable method for dealing with COVID-19. Those were the answers to my two research questions. Thank you very much. Have a good day.
Hello, my name is Yatharth, and I am part of the group 18 for my project. And I will be answering the two research questions which I had given during my EDA. So, my first research question will be using the gradual rise in cases. That will be answered using the gradual rise in cases from April to September's graph. So, the question was, what time period had a more significant rise in the total cases when compared to the different time periods or to each other? So clearly, I have used the EDA to analyze this data, but here I preferred using a line graph, and with the line graph, it was noticed that from July to September, there was a more steeper graph, as you can notice here, than from April to June. It was not a very steep growth, but okay, from May to June there was, but from June to September there was a very steep growth in graph, which showed that time period between April to June, which where many countries were under the nationalized lockdown period, had significantly less number of cases rising compared to when countries started opening up or easing down their COVID-19 restrictions or the lockdown period. And this data was confirmed by BBC. The links are present on our README file. So you can clearly see that there's a gradual rise in cases, and by July we had crossed the average amount of cases which were being noted, which clearly proves that the lockdown period had a less rise in number of cases compared to the non-lockdown or the um, the ease down lockdown period. Also, moving on to what percentage of the population is affected during this time period. So I have created an individual dashboard which will have a better look at what percentage of population was actually affected using a little bigger graph. But it was evident that there was a sudden rise in percentage of population, and this is the total population. So the positive population compared to the total population into 100, that gives us the percentage. And there was a steep rise in the start due to like our like there was a huge, so when the pandemic really became a pandemic, there was a huge rise in cases, and you can clearly see that if I can just refer to here, you can clearly see that from April to May to June, and June to July, till at least July, there was a very steep rise in cases. But then as we went further ahead from August to September, uh, there was a relatively a gradual growth and not a very fast pacing growth, because at that point of time there were multiple recoveries also, and the population had relatively gone higher than what our actual population was at the start of April. So my research questions were, the second research question was the positive percentage in these two timeframes different, or did they still remain the same? Clearly they were different, as there was a significant rise in the start, but it went on to become a gradually linear graph. So that answers the two research questions using Tableau, and I have used a line graph feature here, and I have also used another line graph feature here, but I have used a different so my data source has a different column which is being used, which is the percentage population column which is being used, and that was cleared and cleaned by me. And I have used the average, the columns has the average percentage positive and uses the month as my research question has mostly, my part of the research question has mostly dealt with the time periods. And if I even go to the total cases, you can see that I have a list of, I've applied a filter of on multiple countries which can be used. So if you check out and you want to check a specific country, that this graph will let you do that also. Hence, that ends my case for the two questions which I have proposed. Thank you.